Hi everyone and welcome to my channel. In today's video we're talking about the salaries that junior doctors have and why there's been a strike or there's going to be one, and why we want to do an industrial action, what are our thoughts about it, what do we feel about it, and why do we feel like that we need a pay rise. Joining me today is Dr Sunjay Paul, who is a consultant GP working in London, and today we'll be discussing different types of salaries and what we basically go through as junior doctors, very from the beginning when we decide to become a doctor up till now. So hopefully you guys like the video. If you do, please give the video a huge thumbs up and subscribe to both our channels. I'll be leaving a link down to his channel below.
Hi, thanks for inviting me. So I thought I'd jump on because it's an issue that's close to my heart. But a lot of doctors who are, you may not think about it in this way, but are struggling financially along with a lot of other people. So, fortunately, I've now finished my training period and I'm now a GP. And the main issue actually here at stake is junior doctors' salaries. So we're not talking here about the salaries of GPs or consultants. And I think that's an important point to highlight, isn't it? Because it's the junior doctors who are starting out just after med school, who are on relatively much lower salaries, and as we'll explain in this video, are struggling not just with the costs of the normal living expenses that we all have, but with a lot of the costs of the job, which are completely unavoidable, aren't they?
And then what happens is that our salaries, then when they come to us, the loan is just given off, so you never get the full amount. You don't get the full, whatever you're earning. Talking about that, once we become like what are junior doctors is also I want to explain. I know we say a lot about junior doctors, but what is it like? I want to talk about that. Like, would you like to explain it from F1 till, I don't know, junior doctor till the very end?
Yeah, absolutely. So when we start medical school, so in the UK, most people spend between 5 to 6 years at medical school. And if you are a domestic student, so you're from the UK, currently the tuition fees are £9,250 per year. And in addition to that, people often get another aspect of the student loan on top of that. So this is also given to us by the government. This is called the maintenance loan. So that's to help us with day-to-day living costs, things to cover your rent, your bills, food, simple things like that, the costs of living. So all students at the moment are entitled to that, but the maintenance fee depends on how much your parents actually earn. So for example, if your parents earn relatively more money, then you would be able to borrow a lower amount for your maintenance fee and vice versa. But if we look at the average cost, the average amount that an average student can borrow, according to the National Student Money Survey, it's about £5,500 per year. So when we add up that 9,250 to that £5,500 per year, and we look at a student going to medical school for 5 or even 6 years, that cost comes up to about £75,000. So that's right at the end of medical school. Before they start a job, you're already in £75,000 of debt that you will owe. And that's potentially an extra £15,000 more if your degree was 6 years. So that's the first thing to bear in mind, isn't it? The term junior doctor is a bit confusing, and it's a catch-all term which most doctors actually don't appreciate. So when you finish medical school, you start in the first 2 years of your training, and we refer to this as the foundation years, so foundation year 1 and 2. And during these first 2 years, the pay is relatively low, but it does step up gradually. But to put that in context of how much you might expect a first year doctor to earn, it's between about 11, 12, £13 an hour when you incorporate all the hours worked over the nights, weekends, and obviously normal day shifts as well. That is the first 2 years of being a junior doctor. But then there's another between 3 to 8 years potentially of extra training. Sometimes it's even longer than that. And that training is to help you specialize. So for example, to train to be a GP, it takes 3 years after those foundation years. To train to be something like a pediatrician, that's another generally about 8 years. So it really does vary and it depends on exactly where you decide to specialize in. And of course, some people are not exactly sure initially, so you may start off doing what's called core medical or surgical training, where you do general specialist jobs, where you try different rotations before then going into the final specialism. So all of those years, so you could potentially be, well into your 30s, sometimes even into your 40s, when you are technically classed as a junior doctor, and you go through the stages which we refer to as doctors as a senior house officer after your foundation year training, and then into a registrar. Now, to put this in context, a registrar is a very high level of responsibility. You may often be the only person in the hospital at night covering a large number of wards. You are involved in making really important decisions about patients' care, and you are directly below the consultant for that team. So it's in some respects a bit of a misnomer for someone to be called a junior doctor and yet be a very senior level in terms of skills and knowledge and responsibilities in the hospital. So that's why we were a bit hesitant about using this term junior doctors.
Yeah. So, an interesting thing that I actually want to talk about is, you know how we're termed as saints, like people who should be working for free. I know there's been several types of strikes. There was an industrial strike by the train people, and everybody had some inconvenience, but I don't think it was frowned upon. I mean, nobody started, having a hatred towards train people. The whole train industry, the railway people. But if we talk about it, even when you talk with the friends who are not medics, there's a lot of like hatred sort of thing that's going on. Like, why do you need money? You should be working for free. So what's your take on it? Like, I would love to know. What do you think about that?
That issue is raised all the time, whether doctors should be allowed to strike. And I guess the point is that we don't want to strike. No one wants to have to do this. And this is a measure of last resort. And in truth, in the UK, doctors don't have a very good history of striking because we have this need to try and help and support patients. So it's not something that we have done very frequently at all in the past. And the closest we got to it was in 2016, during the last time when junior doctors were considering striking, and even when we did try it then, we didn't do much in the way of disrupting the normal schedules because we have this desire to help people, and we don't want to leave patients without appropriate care. Of course, at that time they had absolutely appropriate care, and the fact was that if they didn't have a junior doctor there because they're on strike, they did have a consultant who was at a more senior level. So I think the fact is that no doctors want to strike. We don't want to be in this position. Should we be judged for wanting better paying conditions? I don't think that's fair, and I think it's easy when you are looking at a different profession, and maybe you don't appreciate how difficult the job is. You think maybe that they earn very highly and they are expected to do these jobs because it's a vocation, and we shouldn't think selfishly at all. But of course, we're humans. We have bills to pay, we have families to feed, and it's not easy. And so I don't think that there should be this double standard that doctors are maligned for needing to strike. And the difference there is the need as opposed to the desire, because we do not want to strike. And if there's anything possible at all that can be done to avoid that, then I'm sure that we will agree to fairer terms. But I agree with the point that you made, that I think it's not fair that there's this double standard. What are your thoughts on it?
So yeah, I might be hated by all the doctors. Seems a bit too dramatic. And I think that's why I've let people abuse my love for humanity up till this point in my career. Because when I think about a strike, I think about the cardiac arrests that would go on the hospital. I think about other acute things that might happen, and what would less number of doctors do. Like, if a strike happens, my first instinct is to book an annual leave on that day. so that I'm part of the strike. But technically, I'm not actually striking, am I? And I know a few of my friends really hate me for it. And as I told you as well, like I would rather cut my expenses than do this. But unfortunately, it has come to a point now, like even someone like me, who has never agreed with this mode of, action for anything, kind of have started to agree on it. Because even if you budget the amount of budgeting I'm currently doing, there is no way that I can keep up with inflation. So I'm really having really mixed opinions about how it's going to go, what's going to happen. And at the end of the day, I don't want to really damage anyone. And I don't want the NHS to fall. So very confused at the moment I am, like about whether what will happen if they decide a date. Will I book an annual leave and go, or will I just join in as a person who's striking? So yeah, I think that is something that I'm personally thinking about.
I think a lot of people are in the same position as you. And like I said, I think no doctor wants to strike. So this whole situation is hopefully something that can be avoided.
Yeah. So would you like to talk about, like, we've talked about how we become doctors and the amount we have to pay to become doctors. There was an interesting comment that doctors have to compete a lot to become a doctor. Does that mean that we should pay them more? What are your thoughts on that? Like, just because we work really hard to become a doctor, because it's a very competitive field, there was a comment that I read where it said, it's not a comment basically, it's a headliner, which says, just because someone had to compete a lot to become a doctor, does that mean that they deserve more salary?
The competition is a feature of the work situation that we're in, the workforce that exists, the demands that are needed. And within the NHS, we have a set of pay structures. So, in a sense, the competitive nature doesn't or shouldn't come into it in how pay is calculated at present, because a specialty that has few doctors in it compared to a specialty which has plenty of doctors in it are still technically paid the same. But in terms of general fairness with pay, given that where doctors are generally highly skilled compared to perhaps other jobs, yes, from that point of view, I think it could well be argued that we should be well reimbursed for that, because those skills come at a high cost. So there are a number of reasons.
With the reimbursement.
Yeah, so the reimbursement should be higher, yeah.
Annually for things. Like, it's not just that we want salary to feed. It's like,
So there's a number of expenses that doctors are expected to cover during their training. So we mentioned, by the end of medical school now, you'll have already at least £75,000 of debt for the majority of those medical students. But once you start training and you're not on a sky-high wage at all, you then have continued expenses. And these are unavoidable. These are related to work, and there's no way around this. So, for example, to pay for the licensing to be registered as a doctor to the GMC, that comes with a cost. In the first year or two, it's only £50 and £150, but from then on, it's £400 a year. And then we have exams. So although medical school is over, we still have to complete what are called collegiate exams, which are the exams to specialize in a particular field. And these again increase in number. So it starts off, most people have to cover at least 2 exams, but many have to do 3 or sometimes 4 during the whole training period. And these are very expensive, going from £500 to £1,500 each. So in the course of training, the total could be anything between 1,000, 2,000, or sometimes more. But bear in mind that these exams are really hard. So firstly, a lot of people don't pass first time around, so they have to pay again. Or in order to really just ensure that they do pass, to secure that pass, doctors often sign up to courses or question banks or buy expensive textbooks. All of these cost, again, in the order of hundreds, if not 1,000 or more pounds, just to make sure you pass the exams. After that exam's passed, you then become a member of these colleges or royal colleges. So, for example, there's the Royal College of GPs, there's a Royal College of Physicians, and that comes up with another fee. So, just to be part of that, the fact that you pass the exam is not enough. You then have to pay an annual fee to be part of that college. And then on top of that, once you finish your final exams, again, you have to pay a final fee called the CCT. So that's your certificate for completion of training. So once you've done everything at your junior doctor level, you've completed everything, you can then become a consultant or a GP, and that comes up with another fee. We then have a number of other costs related to the job. So, for example, insurance, which we call indemnity, this covers our work as doctors, that has a fee. We also need to be part of a union in case there are issues with our pay, such as this. That comes up with another fee of around £30 per month. There's expenses related to all kinds of things. Doctors obviously use very specialist equipment, which is not cheap. So this can cost anything between £200 or £300 to £500-600. These are things like stethoscopes or otoscopes or ophthalmoscopes, scrubs, things for surgeons in theatre. All of these things add up, and in my calculations, and I've gone through with a fine tooth comb looking at all the kinds of expenses that we'd be expected to cover in our training, comes out to about £2,500 per year. And over the course of a training period as a doctor, generally, as I said earlier, can be anything from 5 years after medical school up to 10 years or sometimes more. And that total cost of training can be in the order of something like £20,000 almost. So these costs are really astronomical when you look at how much we're actually earning, because there's a massive gap there in how much people think that we would be earning and how much we can afford, but actually there's a massive gap between that and what is the reality, how much we can actually afford and how much our expenses are to do with a job that we simply cannot even avoid paying.
And that is the thing, isn't it? Like, people think just because you're a doctor, you must be earning like a lot of money. And when they look at you, they just feel like, somehow they're on the wrong end of the road and you're just taking all the money, which isn't true. And it's hard for us to kind of explain. But hopefully, I think us talking about it here would create some form of awareness about what actually means to work as a junior doctor. Is there anything else you would like to add?
No, I think that's it. I think it's a hard topic to cover, and a lot of doctors feel shy about that. But I think if we can talk about the facts without the emotional aspect of it, and just state the fact that it's expensive to be a doctor, it's expensive to train to be a doctor, and to ask to be remunerated for that shouldn't be such a contentious subject, really. But here we are, and I think people can make their own opinions based on hopefully what we've tried to explain today, without overplaying the situation. We're simply stating how much we earn and how much actually it costs to be a doctor, and we hope that people may actually think that we are deserving of this requested salary rise, when in fact it's not really a rise in our salary at all. We're just trying to recoup what has been lost.
Yeah, I think it's really important that we tell people that it's not a 30% rise in just 1 year. It's like it's spanning around 6 years, isn't it? Inflation has been going on, and I appreciate that it's in the whole world there is inflation, but I feel like with the bills and the rent and everything, it's kind of just beyond any normal doctor's salary now. Like a junior doctor, I don't think you'd be able to afford normal things in life. Like for me, for example, I have to now think about whether I need to go out or not, whether I need to eat out or not, whether I need to watch this movie or not. It's come to this point when you're thinking about, oh, should I just save these £10? You know? And I don't think it's a good way of living, especially when you're doing constant nights and out of our shifts. I think we probably should be deserving of this raise, but let's see what other people in the government thinks. Yeah. And thank you so much. Thank you so much for being on my channel. It's very nice, very informative. Thank you so much. And hopefully we'll see you again on my channel at some point. Thank you.
Thanks for having me. It was really good to talk about it, and yeah, I'll look forward to speaking to you again soon. Thanks.